We are arguing pro-healthcare regulation to protect the sanctity of life. Pro-sanctity of life with regards to abortion does not necessarily mean that we are taking the side of anti-abortionists. We can frame sanctity of life as a firm respect for the sanctity of a woman's life and her ability to make choices that will best suit her and her situation and/or family. This also applies to the end-of-life debate topic. We need to deal with reality. There are significant numbers of people on both sides of these issues, requiring a governmental stance to be made clear. With the current number of individuals covered under government-sponsored healthcare, approximately 105 million Americans, we are forced to determine if these types of care will be paid for with taxpayer dollars. Regulation potentially makes governmental funds available for evidence-based research to further understanding of sanctity of life issues. Requiring providers to use evidence-based practices will ensure that patients are receiving the most current standards of care. In Ohio, an extremely restrictive law on abortion has been identified in a study as not being the most safe for a woman. It was found that a woman would be 3 times more likely to need extra health care during and after the procedure of an abortion. Regulation can inform medical providers to practice medicine ethically and in a patient-centered way. So this woman in Ohio was given a medication that the physicians were not up to date with in their research, and it was actually harmful to the woman. Regulations do not all have to promote taking away of rights and privileges. Regulation could be used to prevent counselors from taking a stance on whether a woman should or should not have an abortion, rather focusing on the woman's personal feelings and situation and respecting the woman enough to make her own decision. Some may assume that placing regulation on providers who perform abortion will take away access to care overall. Regulations that will be set in place will allow for better care and more scientifically based evidence and educational material for patients, unlike many state laws that currently misinform and miseducate patients. We must promote body-positive, patient-centered regulations. We do not support restrictive regulations. By placing regulations that are positive and patient-centered, perhaps more individuals will be willing to come to the clinics. In addition, with positive, patient-centered regulations, there is always the chance that the social stigma and degradation placed on those that utilize the service will be significantly lessened. Regulation could also support integrated healthcare, where a person seeking death with dignity could depend on their healthcare provider to collaborate and communicate and transition from cure to comfort holistically. Integrative regulations could be made to ensure that aftercare and emotional support is more readily available, especially for families involved. By placing non-restrictive regulations, more insurance companies may be willing to include these services under their healthcare plans, thereby limiting the amount that an individual is responsible for paying for out of pocket. This can also help by improving the access to care overall, if more insurance companies are willing to pay. All of these statements that I've mentioned are true if we believe that our government has our best interest at heart. Regulation promotes standardized and best practice procedures. Regulation potentially also supports educational campaigns that will promote our options on a grander scale, thus reducing ignorance and increasing educated decisions on our health. Think similar to the regulation of tobacco sales. This can be an opportunity to speak to the importance of our role as social workers and active community members. The more active and louder we are, the less opportunity for misinformation to be spread. We believe it is important to believe people are, by and large, interested in truth. Unified population that possesses similar knowledge are more likely to agree upon legislative acts that would affect the whole nation. While ideologies will differ from person to person, culture to culture, race to race, citizens that all possess the same basic knowledge of said healthcare can make more informed and confident choices. This also allows for procedures to be taken out of the shadows and become more mainstream conversations. Patients and practitioners are better able to communicate effectively and make informed decisions when a common language is shared. Common language is created when we are able to talk openly as a community. Patients who make informed decisions will be more knowledgeable of what exactly will be required of them and perhaps can assist in obtaining consistently better outcomes. Non-medically trained individuals can feel more comfortable in researching various medications, procedures, doctors, etc., followed by more confidence with whatever choice is decided upon and whatever procedure they need. Regulation could also allow implementation of patient-level quality assessments so patients can continually provide feedback to improve their health care. This also allows for empowerment of the individuals that are seeking services. Regulated care could allow for patient registries to be created to reform technology systems used in tracking patients. Therefore, medical histories as well as patient care can be shared easily from provider to provider for more integrated care purposes. In summary, we argue that regulation of healthcare on the sanctity of life can be beneficial to the improvement of those services, including but not limited to abortion and death with dignity. Evidence-based research paired with educated patients will lower healthcare costs in the future when patients are requiring fewer appointments overall. When we are working with patients holistically through a lens of integrated care, we can ensure that patients are receiving quality care. Thank you.